Let us now talk about another bacterial disease, that is TB. TB is basically, it is tuberculosis, of course I'm talking about. So let us talk about TB here and what we call as tuberculosis. So we need to first of all understand what is the causative agent for the tuberculosis. So the causative agent for the tuberculosis, it is Mycobacterium tuberculosis, right everyone? So let us talk about the causative agent first. So what is the causative agent? The causative agent is Mycobacterium tuberculosis itself. It's a Mycobacterium, it's Mycobacterium tuberculosis. Okay. Basically, what happens in a TB, or what are the symptoms in the TB, we will understand. But before that, let us, you should know one thing, that when we talk about this causative agent, that is Mycobacterium tuberculosis, this is the same bacteria that was discovered by Robert Koch. So this was discovered by Robert Koch. Right everyone, this is the same bacteria. Now how can we diagnose, how can we detect the TB? So that is called diagnosis. So there is a test that is called Mentau test that is used to detect the TB, right? So the test name is basically Mentau test. In this test, basically we detect presence of tuberculin in the sputum of the patient. So in this test, what we do, actually we detect the presence of tuberculin in the sputum of the patient, in the sputum of patient. Okay, let us now talk about that. What are the symptoms? Let's repeat again. So we are talking about the TB. TB, the causative agent of the TB, it is Mycobacterium tuberculosis, and we can detect the TB through Mentau test, basically. Okay, let us now talk about the symptoms of TB. I'm sure you have heard about it, that a cough for more than 2 weeks, it may result into TB, or so the patient, of course, definitely go for a testing, right? So basically, what are the symptoms in TB? The most common symptom in the TB is that persistent cough, right? So what are the symptoms? Let us talk about that. And make sure TB is 100% curable if the treatment is followed completely, right? We will also talk about sorry, MDR, that is, multiple drug resistant TB. That what is it? We will also understand. But before that, let us talk about the symptoms. The symptoms that were included in the TB is that, first of all, a fever is maintained. A fever is there, of course, throughout the problem. So, but the fever is not like, very high, like 102 or 103 degree Fahrenheit. It is like low grade fever, 97, 98, 99 kind of fever is always there. Basically, so a low grade fever is maintained. A low grade fever. Okay, so basically a low grade fever is there. There is a continuously coughing, or I should say persistent coughing. So the patient shows the persistence coughing. This is also something what we need to understand. Weight loss is one of the symptoms. So during the infection, patient may lose the weight. Of course, not very instantly, but with time. So weight loss is there. Chest pain. Patient may complain for the chest pain. Of course, through the continuous what we so called as coughing, patient may experience what we call as chest pain. The next symptom may be that blood may present in a sputum. Due to the continuous coughing, it may possible that some of the blood vessel, minor rupturation may takes place, that may lead to the blood in the sputum. So blood, so presence of blood in sputum. So presence of blood in sputum, that is also something important. Okay. Now let us talk about the treatment. That what is the treatment? The treatment of TB is antibiotics. It is antibiotics, and we also should know that TB is 100% curable, right? Because let's say if a patient comes to you, you being a doctor, and you advise a particular antibiotics, then patient get a relief actually, right? The patient get a relief from coughing. If in that situation patient leave the treatment in between, then it may lead to further problems. Of course, further problem in the sense, if the treatment is not completed, it may possible that then that antibiotic would not be effective for the next time. So if the bacteria become resistant to many antibiotics, then it is called as multiple drug resistant TB. So that is called as MDR TB. What is MDR TB? It stands for multiple drug resistant TB. Multiple drug resistant TB. How exactly it is? I mean to say, how exactly MDR is there? Let's suppose a patient comes to you and you just give the penicillin, or let's say another antibiotic. The patient take the treatment for some time, then leave the treatment. May possible the bacteria become penicillin resistant, and then the patient next time goes to the doctor, and doctor then give penicillin, but penicillin would not be effective now this time. So maybe that doctor changed the medicine by ampicillin. Of course, ampicillin works, but let's say patient again, leave the treatment in between, and then the bacteria that would become ampicillin resistant, and so and so. So it may possible that MDR may develop, and this is untreatable. So MDR usually, if multiple drug resistant is developed, then it is very difficult to treat. So it is very difficult to treat. Yes, MDR. That is also we need to understand. Is there is any prophylaxis that is available, or any vaccine? So yes, vaccine is available for TB. And okay, I think this much is not visible. I am here. Let me just hide myself for 2 minutes, and then we'll done this. Okay. Let us now talk about any vaccine if available. So yes, vaccine is available. The vaccine is known as BCG vaccine. The vaccine is known as BCG vaccine. B stand for bacillus, that is a shape of the bacteria. B stand for bacillus. C stand for calmatic, name of a scientist, and G also stand for Guerin, name of the scientist. Okay, so these three things we should be aware of about the vaccine. So this is about TB. We need to understand that TB is 100% curable if the treatment is followed completely, or if the treatment is continuously taking on the time, right? A patient should understand that patient should not leave the treatment in between. So that is all about TB. Thank you.